for the patients that it's been determined all of their teeth have to go or they're wearing a denture, what's the implant process and what are their options when they go to your practice?
So in our practice, our goal is to give you a fixed, meaning screwed down set of teeth that don't come out. But for those patients that are in dentures, there are other options. We'll start with what we call the snap-on denture that just has 2 implants that kind of right on either side of what we call the midline. The denture snaps down on it. Think of it just as denture adhesive that you don't have to keep buying. It's still going to rock around, food's still going to get in and underneath it. You take it out, put it in a cup at night, it's still a denture.
And what about the upper? Same thing?
So upper's a little bit harder. You really, to do a snap-on denture, you need a bare minimum of 6 implants. So at that point, it makes no sense to not just put the fixed set of teeth on top of that. So
that don't come out.
That don't come out at all. The lower, yes, you can get away with just doing 2, but you shouldn't do that on the upper. So the upper is one of those things that the only options for that is either a denture or, in my office, that or fixed. I can give you a non-removable set of teeth cheaper on the upper for sure.
So on the lower, for the people that want a full arch of teeth that don't come out, how many implants typically?
As few as 4 implants. With 4 implants, I can give you a fixed set of teeth on the bottom that do not come out. They're screwed down onto those implants. Food won't get stuck underneath them. You don't take them out to clean them at night.
Now what about the upper? Because the upper denture has like suction. So the upper denture is okay.
Well, you don't wear a denture, so to say that it's okay, yes, me and you can say that for sure. But still, yes, you're right. An upper denture typically will get a little bit more suction, so it will stay in without using denture adhesives sometimes. But it's still a denture. It's still plastic. Some patients will gag from it. It's a lot of material in their mouth. So there are patients that just don't like wearing them.
So how many implants then on the upper if you're going to give them a full arch of teeth that don't come out?
I like to put in 6 on the top just because it's a little bit stronger for my patients, but you could still do it as few as 4 implants on the top for something that does not come out.
And the palate is not covered at all?
Doesn't cover the palate. It's just covering where the teeth used to be.